Hey, physiology students. This is the next lecture installment for Chapter 4, Part 2, Central Nervous System Physiology. So I'm going to share the screen and we're going to look at the PowerPoint. Okay. So the last time we had lecture on the video, we were talking about the cerebrum and all the divisions of labor of the cerebrum. All right. So now what we're going to do is we're going to go to the next brain region, the diencephalon, and then continue down through all the brain regions. So let's start with the thalamus and the hypothalamus, both found in the forebrain, but it's called the diencephalon. And this should be review from anatomy. So I'm not going to talk much about the thalamus, and I have a few slides at the end of this lecture to kind of explain what it is that it's doing. But really, I want you to think of the thalamus as a relay station or a post office. So in a post office, mail is coming in from all different parts of the country. Okay. So, and at that post office, that information gets sorted and then it gets sent out where it needs to go. So if you think about the thalamus, that's exactly what it's doing. It's taking in sensory information from all over the body. Okay, that's going up the spinal cord to the thalamus, and then the thalamus is going to send it to the parts of the brain where there's a cortex for interpreting that information, and then possibly a motor response will be issued, and then it'll come down from the higher brain regions, then get sorted by the thalamus, and then sent back out to the peripheral nervous system. So that's what that does. Okay, but the hypothalamus, which lies below the thalamus, that has a lot of neurons. We've learned about some of those neurons way back in chapter 1 when I talked about regulation of your body temperature through negative feedback and also positive feedback involving breastfeeding a child or during childbirth. Okay, so let's start with that. The next slide will be, if I get it to go, what the sorting of information looks like from your body up the spinal cord to the thalamus. That's just what this image is about. So basically, down here, if you have receptors for pain or temperature or pressure or vibration, if you perceive that through those receptors in your body, that sensory information is going to go up your spinal cord and ascend to the thalamus, which are these little pink hemispheres here, and it's going to send that information to the part of the brain that is going to interpret it. So if it's sensory information, based on what we covered in the previous lecture, that's going to go to the parietal lobe, which has a sensory cortex. And so that's where it's on its way to. Okay, so this is what the thalamus does. But let's move on to the hypothalamus. Okay, do not memorize this figure. It's just meant to show you there are a lot of nuclei in the hypothalamus. And really, this is about autonomic functions, things you can't control. So it's going to control, we'll find out when we get to the endocrine system, it controls the pituitary gland. It's kind of like the commander or the general. And the pituitary gland, the master endocrine gland, is simply a captain that issues the orders in response to a command it got from the hypothalamus. Now, we've talked a bit in the previous chapter about your autonomic response during a fight flight, and that involves epinephrine. Epinephrine is secreted from your adrenal gland in response to commands by the hypothalamus. So the hypothalamus is actually in control of your fight flight system. All right. Okay, so let's look at some of the nuclei. We won't cover all of them, but just the ones that I think are relevant. So the first nucleus is the supraoptic one, and that is your body's water balance center. This nuclei is going to produce ADH, which stands for antidiuretic hormone. This hormone is going to cause your body to retain water in the kidneys. So it's your way of holding on to body water instead of losing it as urine. We'll cover that in another chapter. Now, this nucleus we've covered in chapter 1 with the positive feedback. Paraventricular nucleus produces oxytocin. So if you remember back in chapter 1, when I talk about positive feedback loops and the two examples I gave you when breastfeeding a child and when in childbirth, the hypothalamus releases oxytocin into the body. Okay, the next nucleus is the anterior nucleus. And the reason I've got the ANT underlined is because when I think of the anterior nucleus and its role in regulating body temperature, which occurs through negative feedback, I remember this nucleus because it has the letters ANT. And that makes me think of Antarctica. And Antarctica is a continent, and it's a cold continent, and cold is a temperature, and that's how I remember it. Okay, next, the ventral medial nucleus. Now, this is for autonomic regulation of, well, when you know that you're full, and it's basically your satiety center. It's you're satiated, you're full, stop eating, okay? It's also a nucleus that regulates um, pretty much your fight flight, okay? So fear, aggression, and then also your hypothalamus is control of all things reproductive. So the ventral medial nucleus is responsible for the four F's, and those four F's are fight as part of your fight flight response in the sympathetic response. It's also responsible for fear, and that's the flight part of the fight flight response. It's also responsible for, well, feeding. When you're hungry, the urge to find food, eat food, is very strong. And then lastly, for reproduction, I use another F, but a safe one for the workplace, fornicate. Okay. So those are the four F's that the hypothalamus controls through this nucleus. All right. Next, the lateral nucleus is about hunger regulation. Okay, so when I see that word lateral, I think of the letters ATE, which means eight. So think hunger. Okay. Next, the preoptic area or nucleus in the hypothalamus is when you're dehydrated, it is the stimulus to drink. All right. And if you've ever been thirsty, you know that's a very strong impulse. All right. You can't think of anything else but a cold glass of water when you're thirsty. And lastly, your suprachiasmatic nucleus is your body's sense of day and night. It's your circadian rhythm, all right? And that's really going to involve melatonin secretion from your pineal gland. All right, so that's 3, 4, 5, 6, 7 nuclei that you'll want to know. All right, moving on. We're going to go further down below the diencephalon and go to the midbrain, which is basically located in the mid part of your brain, below the diencephalon, but above the pons. Okay, so in the midbrain, there are two nuclei in the posterior region. You learned them in anatomy. The first one, the upper bump, which is, let's see, moving this thing out of the way. The superior colliculus is up here. And then below that, that bump below that is the inferior colliculus. So if you look in the mirror, what is higher, your ears or your eyes? What is anatomically higher up? Okay, I'll sit like this. The eyes are higher than the ears. Okay, so think of the eyes as superior and the ears as inferior. So think about that when you're thinking about the superior colliculus. It is taking visual information. It's for tracking moving objects. You don't think about it on a daily basis, but when you're driving your car and you see someone coming towards you and they're starting to veer into your lane, your superior colliculus is getting the visual information, and it's going to stimulate an emergency response by you or an autonomic response by you, which is to avoid getting hurt. So when a car starts veering into your lane, you get out of the way. Okay, you start to turn out of the way. So that is the reflex visual tracking of moving objects, because it can be life saving. So I have this GIF here where someone is throwing a ball at a person, and obviously this person does not have a good superior colliculus, because I'm sure they can see that ball coming at them, but they haven't ducked out of the way. Okay, now the inferior colliculus is controlling reflex responses to sound. So when you hear an unexpected sound, you tend to turn and focus all of your senses towards that sound in case it's life-threatening. So think about this. We've probably all done this. We've probably been on our phone, walking across a crosswalk, not looking, and then a car is coming and they honk their horn and you stop everything and you focus all your senses on that. That turning your head reflexively to an unexpected sound is controlled by the inferior colliculus. And so I have this gift where there's a truck approaching these guys walking with their backs turned. He honks his horn, and not only do they turn to the source of the sound, they actually fall down. But that reflexive turning your body to the source of the sound, that's the inferior colliculus. Okay, the red nucleus right here, okay, that is for autonomic or unconscious control of your posture muscles. So when you're sitting upright in a chair or even just standing or balancing, such as this guy is doing on a balance ball, those core muscles, they're controlled by many things, but the midbrain has the red nucleus to help tweak those muscle contractions just so that you maintain balance without falling down. Okay, next, the substantia nigra. We talked about this in chapter 4, part 1, neurotransmitters. So in the midbrain, these dark areas right here, what it says SN, substantia nigra, they're darkly colored pigments because those neurons are pigmented. And basically, this is the part of the midbrain that produces a lot of dopamine. And we talked about dopamine before. Dopamine plays a role in fine motor control. Thus, when people are lacking these neurons in the substantia nigra, they're losing dopamine, and that loss of pigments in this particular area of the midbrain is a diagnostic feature for diagnosing someone with Parkinson's, because Parkinson's is associated with low dopamine, and then they lose that fine motor control without it. Now, the mesolimbic dopamine system is all about addiction. So every time you do something good, you feel pleasure, like food or drugs or other things, you get a little squirt of dopamine, and that reinforces the pathway. So you're inclined to do it again and again and again. So dopamine is involved in fine motor control and also the pleasure or reward center. Okay, now the entire brain stem, which includes the midbrain, which we just talked about, and the pons, which we'll talk about next, and the medulla. And notice this purple structure they've shown in the figure here. It goes all through the brain stem. So we'll talk about the reticular activating system later on. Okay, so there's a clinical app reading. It's right here in the PowerPoint, but I'll let you read that on your own because it's in the online PowerPoint PDF. But all you need to know is that drugs, if they produce a pleasurable feeling, are going to stimulate dopamine release because dopamine is part of the limbic system. It's part of the reward center of the brain. And so it's the dopamine release associated with doing these drugs that is responsible for psychological addiction. So, nicotine, cigarettes, you get a dopamine response. It's a dopamine agonist, and cigarettes are very addictive, almost as addictive as heroin and morphine. Okay, and these particular drugs are dopamine agonists, and they stop GABA inhibition of dopamine. That's how they seem to work. But just remember, dopamine agonist. Valium, the muscle relaxant, is a dopamine agonist. It's also an agonist to GABA. But so people can become addicted to these muscle relaxants. Cocaine, methamphetamine, crack, amphetamines, all those things are dopamine agonists, as is alcohol. And all of these substances can lead to use of these over time can lead to psychological addiction. Okay, moving on to the last part of the brainstem, the pons and the medulla. So the pons, it is right here in green. I circled it. And like to think of the pons because it sticks out to the anterior. I like to think of as the pregnant belly of the brainstem. And all you need to know about the pons is that it has part of the reticular activating system, and it has two respiratory centers, the pneumotaxic center and the word apneustic center. Notice PNEU, new. New means air, like a pneumatic nail gun. It uses air to send nails into boards, but new or pneumo means air. Okay, the medulla. We've talked about that a lot this semester. So the medulla also has part of the reticular activating system, and we've talked about its role with controlling heart rate, your artery diameter, and some other things. But what I didn't mention up until now is it controls other autonomic functions that are kind of like all or none events. So sneezing, once a sneeze has begun, you can't really easily voluntarily stop that. The same thing happens with swallowing or gagging or vomiting. Once the action has started, it goes to completion and you really can't stop it. It's also a place where you get crossover of motor information coming from your motor cortex. So the frontal lobe has the motor cortex. We've covered this. The left hemisphere controls the right side body movement, and the right hemisphere controls left side body movement. So obviously, the motor information does get crossed in the brain. Now, this is going to be some review. The medulla has a cardiac center that controls heart rate in regulating blood pressure. It also has a vasomotor center, which can control your arteries, which have smooth muscle, and you can make your arteries vasodilate or vasoconstrict. Although I have arterial dilation here, the opposite also happens, constriction. Now, it has, this is new, a respiratory center. In fact, it's the medulla that controls what the pons does. So the medulla is kind of like the boss of the brainstem. It controls lots of things. Okay, the reticular activating system. So back in the cerebrum, when I was talking about deep sleep, I was talking about when you go into REM sleep, you're going to have um, inhibition of your skeletal muscles through GABA, so you don't get up and walk away. But what, so those are inhibited, but your emotional brain remains active. Okay. Now, GABA inhibits your skeletal muscles so you don't get up and walk away when you're in deep sleep. That's a lifesaver. But GABA also quiets your brain's activity so that you can block out unimportant stimuli or stimuli that's not life threatening. So if you've lived in a dormitory, you've learned to block out the white noise of activity in the hallway or neighboring rooms and things like that. That's white noise. However, if your brain, while you're in deep sleep, senses important stimuli, something that you've learned over your lifetime, I have to attend to this. This is important. The reticular activating system will rouse you from deep sleep so you can attend to that. So when I think of reticular activating system, I think of all the cats in my house. I have some cats. And when they're sleeping or pretending to sleep, I could say, come on, baby, come see me. Come see mom, right? And they're just sound asleep. That's not an important stimulus for them. However, if I go into the pantry and get out a can of cat food and ever so quietly pop that can open, all of a sudden, cat will awake. So, sleeping cat smells important stimulus, awakened cat. Okay? This is your reticular activating system. You sense a stimulus that you attributed to be important enough to wake up from, and it rouses you. Here's another way to look at it, something students will definitely relate to. Have you ever zoned out in a class or fallen asleep in a class? And then all of a sudden, an important stimulus occurs and you wake up suddenly, right? So think about, see this guy is asleep, and the class starts clapping, and then he wakes up from the reticular activating system and he automatically, yeah, I'm here, I'm awake, right? That's your reticular activating system. Okay. Next, let's talk about the neurotransmitters responsible for the reticular activating system. Okay, so you have three excitatory neurotransmitters. One you've learned about, acetylcholine is always stimulatory in the brain. Remember this because when you lose acetylcholine, such as what happens in Alzheimer's disease, the brain, parts of the brain lack that stimulation, and then parts of those neurons die, parts of those brain areas die from lack of acetylcholine. Also stimulatory in your brain are dopamine, which is stimulatory, and norepinephrine, which heightens awareness in fight flight mode. And then hypocretin is more recently discovered as a stimulating neurotransmitter in the reticular activating system. And they've discovered its role kind of accidentally by looking at people who have narcolepsy. And people who have narcolepsy tend to fall asleep at inappropriate times. And they found through brain scans that and testing them, that they seem to lack hypocretin, and that might play a role in why they fall asleep at unusual times. Now, there is the one inhibitory neurotransmitter, one we've covered already, um, GABA. So, GABA quiets your brain, as I just said, during deep sleep, and it also inhibits your skeletal muscle movement when you're in deep sleep. Okay? Now, there are some drugs that affect the reticular activating system. There's an online clinical app reading, but it's also embedded in the PowerPoint. So we'll go look at that. So amphetamines can stimulate dopamine action because they're dopamine agonists, and that is stimulatory. And so that can affect the reticular activating system. Benadryl um, also can affect the reticular activating system because it inhibits histamine releasing neurons of the reticular activating system. Benadryl also blocks acetylcholine activity of the brain. So you get drowsiness for two reasons: it's an acetylcholine blocker, and it inhibits the reticular activating system. So that's why you get drowsy, or some people do. And Valium also causes drowsiness because it enhances GABA action. So it's a GABA agonist. We've mentioned that one before too. Okay, at this point, we're going to talk about the cerebellum, and we'll probably stop the lecture at this point. But the cerebellum, you learned a lot about it in anatomy, but it's about balance and posture. Thus, I have someone doing yoga. It's also responsible for muscle memory. So when you log into your phone, you've got a pattern or a code you put in. Do you ever even think about that, or do you just kind of do it automatically? That's a muscle memory. When you get in your car, if my car has a shifter by the driving wheel, and if I've rented a rental car and it doesn't have it up at the driving wheel, I get in the car. I immediately reach up here for the shifter, and I'm like, oh, it's not there. It's one of those cars where it's down in between the seats. Me reaching up automatically without thinking, that's muscle memory. Your ability to ride a bike, once you've learned to ride a bike, that is muscle memory. Okay, you don't have to relearn how to ride a bike if you've not ridden a bike for a few years. It's just there. Now, sometimes people can damage their cerebellum from head trauma, or they could be born that way. I know some people and animals are born with decreased growth of the cerebellum. Um, and cerebellar ataxia is basically the inability to control your muscle movements. So you're wobbly. Okay. Now, if this happens to a person, you'll see things that are called intention tremors. What happens in a person with a damaged cerebellum, they may reach for an object, and as they get close to the end of that movement, they miss it, and then they try and compensate. And now what happens is they get this intention tremor in their arm. So let's look at a YouTube video very quickly of a patient with an intention tremor. Okay, so the doctor asks him to touch his nose, which most of us could do with our eyes closed. But at the end of his range of motion, he is missing, compensating, and you see that wobbling of his finger. That's a classic intention tremor from cerebellar ataxia. Okay, so this is a good place to call this lecture done, and we'll pick up with the continuing lecture after
I'm Dr.
this.
Ken Chapman, Director of the Asthma and Airway Center at the University Health Network and Director of our